Okay, so I'll just move to the. Yeah, this is a slide share. So today's topic is the knee. Okay, so knee is the one of the main. Just a second, please. I cannot see. Okay, yeah. Belle, can you see me?
Yep.
Okay. Hi, everyone. So thanks for coming today. And today's topic is we are talking about the knee. So knee is the one of the important joint that takes lots of pressure, especially when we are putting the weight on it. When we are walking, the knee is the one of the joint which takes whole weight of the body. And it is the one of the joint where it undergoes for lots of wear and tear, and it takes lots of pressure of the body too. So it is important to take care of the knee. So there are so many conditions where we where we can keep our knee to get injured or damaged. So it is a complex joint, and a lot of things can go wrong. So too much overuse of the knee can damage lots of structures inside the knee, where we are going to talk about. And there are a few conditions where our own body attacks our own joints, so where we are going to discuss about that one as well. Okay, so let's know about the structures of the knee, and we are going to keep it very simple. So as we are seeing in the picture here, so there's a top of the bone called as thigh bone. We call it as a femur, and at the leg bone we call it as a tibia. And there is a small bone in between, this called patella. So these are the three main bones where the knee has, and each bone has some coverings. We call it as a cartilage. And there are other important structures. There are ligaments that holds the knee really strong and stable, and there are other structures called meniscus as well, where we can see here as a rubber cushions, where rubber cushions where it gives extra stability to the knee joint as well. And if we as we are seeing in the picture here, there's a white bands here where we are seeing these are the ligaments. So this is called anterior cruciate ligament, and inside the thigh bone we call it as a medial collateral ligament. Similarly, on the outside, there is another ligament also there. We call it as a lateral collateral ligament. And it's hard to see. There is another ligament inside the knee joint. We call it as a posterior cruciate ligament as well. All these ligaments provide stability to the joint, especially when we are moving, and when we are standing up, when we are putting the weight, and we are moving the leg in different directions. This is the main structures where it can go lots of wear and tear as well too. Okay, so let's talk about the problems with the knees. So what is the chronic knee pain? Chronic knee pain is we have the pain more than a few weeks. So for example, more than 3 to 6 weeks, pain is there. It is ongoing. It is not going down with simple rest or using the simple ice pack. So this is any pain that presents more than 3 to 6 weeks, we call it as a chronic knee pain. Okay. So what is the reason behind it? There can be multiple reasons what can bring the knee, this chronic pain. So sometimes we always may think the problem is only in the knee. Sometimes problem is there on the other joints as well, where those joints or the muscle imbalance can put the lots of stress to this knee indirectly. Okay, we are going to discuss about that one as well. Okay, and each person's experience is different with what they have been through, how they are using their knee, and there are multiple conditions where the pain can present in the knee as well as other joints too. Okay, so let's talk about those types of the pain in the knee. So what could be the reasons inside the knee? And we are going to talk about what are the other reasons coming from other joints or other muscles too. Okay, so coming to osteoarthritis. So this is the most common condition where we see it is the wear and tear of mechanical wear and tear of the joint. So where the cartilage is undergoing for lots of stress, and it is getting damaged gradually, and it gives the lots of pain. And in severe cases, it can bring the inflammation and joint swelling too, and it will disrupt our walking, and the range how much it is moving is limited because of the pain and the deformities too. So here, when we are looking at the picture here on the right side, here is the cartilage where it is really healthy, and when we are using it, when we are overusing this cartilage, it is worn off. If we see in the pictures, there are worn off cartilage is there, and where when the cartilage is damaged, the bone is coming to the contact with the other bone where we feel the really bad pain. And if it is in chronic cases, we can observe, we can notice a small bony growths. We call it as osteophytes that can bring the lots of limitations with the joints and the pain too. Okay. So this is the common presentation of the osteoarthritis, and another type. And coming to osteoarthritis, it is a more mechanical. And there is another type of arthritis. We call it as a rheumatoid arthritis, where as I said before, our own body system is attacking the joints. So it is a in the osteoarthritis, there is a irregularity which bone is attacked, which joint is attacked. So in osteoarthritis, the joint which we overuse, that's the joint which is getting damaged. Whereas in rheumatoid arthritis, it can happen. It will happen on both sides of the joint. So it will start with the small joints like fingers, wrist, or the toes or the ankles, and it can spread to the knee as well. Okay. So this is the common presentation with the rheumatoid arthritis. Generally, what we see, the lots of pain, redness, swelling, limitation with the movements. These are the common features with the rheumatoid arthritis. If we are seeing those features like more than two joints, similar joints like both ankles, both knees, and both sides fingers are attacking, and it's happening. Lots of redness, swelling. If we are seeing, that is important to identify it as a rheumatoid arthritis, and it's good to see the doctor to calm it down. And then we need to have the rehab to make the joints to move, get better, and get the conditions of the joint. Okay. So as I said before, osteoarthritis can strike one joint, like one knee, whereas rheumatoid arthritis can attack the both sides of the joint at the same time. Okay. And yeah, it can also affect the small joints like hands, wrist, and other symptoms we can see is a fever and lots of tiredness. And another common features we notice in rheumatoid arthritis versus osteoarthritis, in the morning stiffness, in rheumatoid arthritis, it will stay more than 1 hour, whereas in osteoarthritis, it is present in the morning, but it should get eased by less than half an hour time. These are the common difference we see osteoarthritis versus rheumatoid arthritis. It is that's the feature. Okay. And the next, another important structures are the ligaments. So we are going to discuss with how the ligaments are injured. Okay. So ACL, anterior cruciate ligament. So as we are seeing in the picture here, it's connecting the femur, thigh bone to the leg bone. So it's providing the stability. It doesn't let the leg bone to move too much forward. It is holding the joints, especially when we are running, walking, and sudden twisting movements too. Okay, so if you are suddenly if you are doing forcefully suddenly stopping and twisting or pivoting these joints, it's a lots of stress can happen to this ligament. There is a possibility of the tear happens to this ligament, and there are different types of different grades of the ligaments. So it depends on the grade. We need to design, we need to identify which level, which grade the problem is, tear is, and based on that, we need to design the treatment as well. Okay. So when it is happening, we will hear a pop sound, and right away we will notice pain, and right away we will notice the swelling, and struggling to walk, weight bear. These are the immediate changes we notice if any tear happened to the ACL. So commonly we see in sports players like soccer, football, and basketball players, where they have to run, and they have to suddenly change the direction, and they suddenly stop how they are running, and this where they are stressing the ligament a lot, and there's a high chance to get the tears to this ligament. Okay. And yeah, so and another way it can injure is if anything hits behind the leg bone. So as I said, please, it's trying to stop the leg bone to move to the front. If any forceful hit happens at the back of the leg, that can damage the ligament too. And we will see the swelling, pain, and struggling to walk right away after the injury. Okay, this is one commonest ligament that can injure in the knee. Okay, so next common ligament what we see is medial collateral ligament. So this medial collateral ligament stays inside the knee, where I'll just quickly show you where it presents. Okay. So I'm just moving the knee camera down. So this is the area where the ligament presents. Okay. And what happens is it is presenting it is holding this knee joint. Try not to move like this. Try not to open the knee from sides. Okay. And at the same time, on the opposite side, there is another ligament called lateral collateral ligament. It is also providing the stability to hold it. So how this can damage is, again, when we are trying to change the directions. For example, if we are skiing, right? So when we are skiing, we will try to go like these directions. So when we are doing these directions, we are putting lots of stress on the ligament. If we are doing too much too forcefully, that can damage the ligaments too. So again, the treatment is we need to see how severe the ligament damage is. There are different types of the different grades of ligament, where I'm going to discuss soon. And this ligament connects from the thigh bone, as I show here, the structure of the ligament, how it looks. Okay, that is a thigh bone. So it's starting at the bottom of the thigh bone, and it connects to the leg bone. This is where how the ligament sits close to the capsule, outside the capsule, and inside the capsule, it's staying really close to the meniscus as well. If it is really severe, that can this damage can associate with the meniscal injury too. I'm going to talk about the meniscus soon. Okay, so what we are noticing here, so it is a similar like ACL injury. We will notice pain, tenderness along the inside the knee, and we will notice the swelling too right away. It depends on the extent of the damage, and you will feel the instability. You will feel the knee is going to give out when you put the weight on it. Okay, and you will see the locking, catching of the knee, especially when you are trying to walk and doing the stairs. Okay, And stability is mainly happens with the grade level 2 or 3. So we need to know which grade the damage is happening. So it's good to know the types of grades. Okay, so the ligament has 3 types of grades here. So if we are seeing this as a ligament, okay, so grade 1, we are overstretching the ligament, but there is no tear. So in this, you will be getting the pain and mild inflammatory reactions. As soon as the pain is down, you will feel comfortable. Again, we need to train, we need to look into the muscle imbalance and corrections too in the grade 1, okay? Whereas grade 2, it is a partial tear of the ligament. So for example, it is a full ligament here, and this is grade 2. It is not torn fully, but it is torn half. So in grade 2, you will get pain right away, swelling in all inflammatory reactions, and you will feel unstable knee as well. Okay. And with grade 1 and 2, we need to have the good rehab program to get better, to condition the knee. Otherwise, this problem can go chronic. Whereas grade 3, so the problem is that ligament is torn fully and completely separated. So you will feel the instability and the swelling right away, but the pain levels are really less for the grade 3. And as soon as if we find it is a grade 3 level, you need to see the doctor as an emergency. Okay, so and after you need to have a kind of a surgery too. So after surgery, we need to continue with the rehab. So that is the grade 3 ligament tear. So these are the different grades we need to assess properly, and we need to go into the conditioning of the knee before you return back to routine activities. Okay. Next one, tendons, right? So tendonitis. So tendons are the, if you're seeing here, so this is the thigh muscle where it is ending as a tendon. So ligament is connecting bone from the bone, whereas tendon is connecting the muscles to the bone, okay? So in the medical terms, itis means inflammation. So tendonitis, so inflammation to the tendon. So there are multiple reasons why the tendon is getting inflamed. So you can, so as given in this slide, you can tear or strain any of these tissues that holds the knee together. Ligaments connects the bone as a bone to bone, as I said, and tendon connects the bone to the muscle. So when we overuse these tendons, that can, when we overload these muscles and the tendons, that can go into stress, and that can go into inflammation reactions like, again, pain and swelling and limitations to the movement. Okay. So tendon is a kind of acute conditions where it is presents problems within 3 weeks time. Whereas tendinosis is a chronic tendon problem where what's happening is, okay, we are overloading the tendon, and there can be, if we go into microscopic level, there can be a small tear can happen, and it will try to heal, but we are overloading it again and again. We are trying to making the tendons to, in the microscopic level, lots of tears are happening. Okay. And so gradually what happens is the tendons goes into degeneration, and if it is like, if we don't treat them properly and if we continue to load them, that can lead to a tear gradually. Okay. And this can happen in 3 weeks to 3 months time. And the tendinitis is tendinitis is usually linked to an injury. So we have had done something, and the tendon got damaged. So that's where the tendinitis inflamed. And but whereas tendinosis is a gradual or repetitive overloading to the tendon. And yeah, this is the main differences with the tendinitis with tendinosis. And Tendons take, coming to the recovery process, tendon takes longer time to heal because there is a less lack of blood supply to the tendon, and very less blood supply. And the good thing is we can make the tendons to becomes back to normal within 3 to 6 months, more or less around 80% of the people. Okay, so in tendinitis, the recovery level is faster. It can be recovered within 1.5 to 3 months, whereas tendinosis, it takes 3 to 6 months time. So, but we need to have a good rehab program to get back into normal. Otherwise, what happens is, again, we might attempt to do the same mistake again and again. It is trying to, okay, you're trying to work on, is getting better, but as soon as you feel the pain is less, and you are able to, you feel that you are able to do, and you did something, and it will come back to square one. So it is important to have a complete rehab program, especially with these problems. Okay. So that's what. So if these tendons left untreated, it can undergo for complete rupture, and if again that can be a chronic, that can become a chronic problem, and the limitations with the activities what we want to do. And we can prevent these tendon issues by doing a proper warm-ups thoroughly before the exercises. That helps to improve the flexibility in the tendons, and the stress loads will be less when we do a proper warm-ups and cool downs. If in case you have tendinitis or tendinosis, giving a proper rest and reducing the load and having physiotherapy will recover the process and improve the long-term outcomes. For example, if you want to go for running, but because of this tendon problem, you are not able to run, because as soon as you run for certain distance, you're getting the knee pain, and you're trying again, but because of the pain, you stop. You try it for 2 to 3 times, again you stop, because, and then what it happens is you will lose the interest to go back to running, because we don't know what is happening exactly and why it is happening exactly. So it is important to know what's that's bringing this tendon the problem. Okay. Next one, common tendon is IT band. IT band is the band that stays on the side of the thigh. Okay, on the outside of the thigh. So where it is a thick band on the top, it will there are a muscle called tensor fasciae lata, and it will continue down as the IT band. It connects to the leg bone as shown in the picture here. Okay, so what happens here, once if the IT band is either overused or overloaded, and if it becomes so tight, what happens is this band rubs on, for example, if it is a thigh bone and the band is here, when you are moving the knee, especially when we are running or when we're doing the cycling, or if you're doing the hiking activities, you are rubbing this tendon on the bone again and again repeatedly, where you will get that irritation happens to this tendon, and you will get the pain, and in severe cases you will see the swelling, and you are really struggle to move the knee. Okay, so and these are the common symptoms we see, and this condition can be successfully treated with physiotherapy, as it's a muscle imbalance, as it is a muscle imbalance that responds. We can treat it with a right rehab program. So what happens is IT band, it is surrounded by hip muscles as well, glutes as well. If those glute muscles are weak, it will put lots of stress on this IT band, and we'll attempt to use a lot rather than using the right muscles. So in physiotherapy, we will try to identify where not only the IT band irritation, so where it is problem coming from. Is it exactly a problem at the IT band? Is there something else bringing the problem to this IT band? So we need to assess this, and we need to design a proper exercise program so that we can improve the flexibility of the tendon and the muscles and improve the strength. And so with this exercises program, we can reduce the load on the tendon so that the irritation levels are less before you're going back to the activity. Okay. So next conditions what we see is the runner's knee. Another name is patellofemoral knee, and it is a very common problem we see in patients who have the knee issue. Okay. So coming to the patellofemoral knee, so what happens here? So as I shown in the first picture, so the kneecap stays in on the thigh bone, and it's like in a track. Whenever we are trying to move, the kneecap has to roll on the thigh bone in a specific direction. If any muscle imbalance that can, for example, if, as we discussed before, so tight muscles of the quads, sometimes IT band can bring the kneecap a little bit out of its track, or sometimes problem can be weakness of the hip muscles, or sometimes problem can be weakness at the foot. Any changes in the arches of the foot that can bring the kneecap a little bit out of its track. So what happens is the kneecap will be rubbing on the thigh bone. You will feel the pain at the front of the knee and around the kneecap, and you may whenever you're trying to bend the knee a lot, you will feel the pain. And after some rest, for example, if I'm sitting for example half an hour or 1 hour, and I'm trying to stand up, you will see the pain, and sometimes you will see the crepitus, like a cracking bones, and you will feel the popping noise around the knee. And it happens more, especially when you're doing the stairs, especially when you're coming down the stairs. Okay, this is where the pressure more falls on the kneecap, where the kneecap try to stick to the thigh bone, and that's where the inflammation changes, again pain and limitation with the movement can happen. Okay. So this is a overuse and misalignment problem. So where we need to assess fully, and we need to design the exercises based on where the problem is. Sometimes we need to prescribe some orthotics and supports as well, especially for the foot, if it is a flat foot or pronated foot. Okay. And next one is the meniscus. Okay, so as meniscus is a kind of a rubber cushions, as you are seeing here in the picture here. So that is the outside meniscus. This is the inside meniscus, where it is what is it doing is it's a kind of a rubber cushion where it's giving the kind of a shock absorber when you are when you are putting the pressure on the knee. And it's deepening the joint structures too, so it is giving extra stability to the knee joint. Okay, and this can damage with especially when you're trying to stand and run and sudden twist and pivoting the joint. So you're trying to turn that quickly, so where you are putting the lots of stress on the meniscus edges here, and that can, if it is the pressure is too much, the force is very quick and very high, that can lead to tears as well. Okay, so what happens here is you will notice a stiff knee, and the knee, you feel the knee is really locked, and you will feel the pain and swelling as well, especially when you are trying to extend the knee and bend the knee to the end ranges, depends on where it is damaged. Okay, and you will feel unstable knee, especially when we are putting the weight on the knee, and when you're doing the stairs. These are the common activities where you feel the problem. Okay. So this is where this is the big picture of the knee. Okay. So this is where how the thigh bone sits here. So where it's really giving a good deep surface, where it is stable, and the thigh bone will roll whenever you are trying to bend the knee, for example, sit to stand and standing to sit. So this condyle we call, okay, this will be rolling around the meniscus. If any wrong movement, wrong pivot movements that can push the meniscus can damage the tissues too. Okay. Okay, so next time the structures are the bursitis. So what is bursa? So bursa is if we are seeing here the green structures, it's a kind of a fluid sac where it is giving a extra cushions and acts as a shock absorber as well. So here, if we see in the picture here, so a person is trying to clean the floor, but she is kneeling here. So what's happening is this bursa stays in between behind the skin, behind the skin and in front of the kneecap. So it's not, it's trying to give extra cushion, extra support to the knee. But if we overuse the knee like this, so here the person is cleaning the floor, but we can different activities like gardening, and if we are doing the carpet or any renovation work, so we tend to spend a lot of time on the knees, where this bursa can get irritated, can get swollen, pain, and it will very sensitive even after rest. Okay, and we will notice lots of swelling here too. So it is very uncomfortable even to move the knee when it is swollen. Okay. And next one is at the back of the thigh. These pictures are at the back of the thigh. So Baker's cyst, it is a fluid accumulation inside the capsule of the joint. So especially at the back. So there can be multiple reasons. There can be severe arthritis happening inside the joint that's bringing the fluid inflammation that's accumulating the fluid. That can be a meniscal irritation too, that can accumulate the fluid. So what happens here, if it is too much, if you see the difference, this the right side is the normal knee, whereas on the left side you can clearly see a swollen knee at the back side. Okay, so lots of people who have this Baker cyst, they will get lots of pain and swelling, and movements are very limited. And generally the cyst itself doesn't give much problem until unless we disturb the cyst. And but we see lots of it appears the lots of swelling and on your knee and calf as well. Okay, so but we need to find why you are getting this Baker cyst again and again, and is there any structures that is damaged inside the joint? As I said before, is any meniscal irritation? Are there any other structures which is damaged? So we need to see, and once we try to correct that one, and this inflammation, this swelling will go down. And generally, if it is a chronic conditions, the doctors tends to do suck the fluid out, but generally it is not encouraged. There is a chance of getting infections too. It is important to find why you are getting this cyst, what is the reason behind it, so that the treatment will be appropriate rather than temporary. Okay. Okay, so these are the common conditions we see in the knee. Okay, so let's have some break. So is there any questions, Belle?
I don't see anything yet on my end. So anybody
Okay.
who has questions, you can
Anybody have any questions?
type in the chat box, or you can unmute yourself. So we'll have 5 minutes for this. Anybody?
Any questions, anyone?
There you go. I see one. How come when the weather is going to change, I can feel more pain in my knee?
Okay. So we will feel more pain in the winter time, right? So, so what happens is we will feel lots of muscle tightness happening, especially in the winter time. We tend to the changes. Okay, so muscle tightness can happen more when the muscles are kind of undergoing to the spasm. So that will put the lots of pressure on the joints because the muscles are trying to bring the joints more close, and we will try to squeeze. We'll try to keep our joints. We attempt to keep our joints really stiff. So that's why this is one reason why we feel more pain during the change of the winter.
There's one more from Margaret. I'm in line for knee replacements. Can this be avoided?
Yes, yeah. So again, we need to see how severe is the problem again, but there are multiple scenarios we have seen, and what happens is, okay, I would like to give one example where Blair has seen one patient before. Okay, so she was told that she has to have a replacement of the knee, otherwise there is no other choice. So she was waiting for the knee replacement, but she's been through this pain all the time. And Blair had 4 sessions of physio, and the pain has gone down almost to half, and she was like surprised. So again, so we need to see how severe is the problem, okay, and how extent is the damage. And again, it's not only the knee. So is there any muscle imbalance, any muscle tightness that is contributing to the problem? So correcting the muscles strengthening and flexibility, that can reduce lots of stress on the joint. So this can enable us to move the joints really better, and that can improve the activities what we are struggling with before. And definitely we won't say it is 100% back to normal, but definitely there is a chance to make it down and delay the surgery too.
And then about the Baker's cyst. How often could you have Baker's cyst drained?
Okay, so again, generally we see, Blair, do you want to answer that question? Generally we see is, again, injections are generally yeah, Blair, can you answer this question, please? Yeah.
Sure. So Judy, it really depends on what's causing the knee pain. I have had a few patients from Dr. Bray, who's one of our top knee surgeons, that he has drained them. And this one guy was a recreational goalie, so a lot of bending on the knees. And the problem with draining it is it usually just swells back up again in the short term. So, and then you are risking injecting in, an interventional technique that could have a risk of infection. So the doctors are usually pretty good on kind of weighing the risk versus benefits. But if it's something you've had for a long time and you're really frustrated with, sometimes it's worth a try. So it's kind of a really, it really depends on the individual situation. But some people can get relief, and it works great. And then others, I find 50% of the time, it just kind of swells back up again. So, and I think that's because we haven't addressed the underlying issue, which could be like a torn meniscus or a mechanical derangement inside the knee that's causing irritation of the knee, that's causing the knee to swell up. I hope that helps. Oh, one other point too about the weather changes. Sorry, maybe I'll just mention that too. There is some studies that show that the changes in barometric pressure can affect the sensitivity of your joints. And 50% of the studies will support that theory. And then there's another 50% of studies that discount it. But we know that people like rheumatoid arthritis patients with really inflamed knees like to live in warmer climates. And if they go down and live in like the lower mainland Vancouver, it's really can be very wet and rainy and lots of changes in barometric pressure. They won't have a great experience. And so a lot of those people become snowbirds, and they usually go south for the winter. And Shandu is right in that An arthritic joint will be more comfortable in the winter than it will be, or sorry, in the summer rather, in warmer temperatures than it would be in the winter when it's cold, because coldness always makes us feel stiffer, and that creates more compression in the joint. So I hope that helps a little bit too. So to make it through winter, you just got to make sure you're jumping in the bathtub every day, especially in the morning, those of you with really arthritic knees, to really get the knee feeling warmed up and supple for your day ahead. And then doing a lot of the stuff that Shandy will show you in regards to stretches to really start your day off on the right foot, no pun intended. All right, I'll let you guys get back at it. Great presentation, Shandu. You're doing great.
Yeah, thank you.
Okay. We still
Okay,
have one.
so
Can we do one more question before we go on?
yeah, go ahead, please. Yeah.
So Shirley has one. I had a patella tear about 8 years ago, and I have pain when I kneel. Any suggestions?
Again, so we need to assess the knee condition. So how the kneecap is and how the surrounding structures are. Again, when we look into the knee and the kneecap, so we don't not only look onto the kneecap. So we have to see how the muscles are, surrounding muscles are. Is there any muscles really tight, especially this IT band, the vastus lateralis, part of the quadriceps muscles. How the hip muscles are, how strong your hip muscles are. So again, we need to see that one. And any alignment of the joint issues, right? So for example, I told before, so any foot alignment, any wrong foot alignment, for example, I'm going to turn the camera down just to see. So for example, if I'm trying to turn the foot, if that is a normal foot, hope you are seeing. And when if in case my foot is pronated like a flat foot, so I'm trying to turn the foot in. So not only the foot, when I'm trying to move, and I'm trying to turn the knee leg bone as well. So it was changing the alignment of my knee. And at the same time, it is sometimes, for example, if the hip muscles are weak, okay. So for example, I'm trying to go up this, I'm going to show here. When I'm trying to go down the stairs, the knee has to go straight as well. So if in case, if my hip muscles are weak, sometimes we tend to go the knee wobbly, and sometimes we go in. So that is also is change the knee alignment too. So we need to see how these alignments and mechanical changes are happening. So based on that, again, we can design the programs, exercise programs too. Okay.
Okay, I'll continue
Hope that
reading
answered the
all the
question.
questions later in our Q&A.
Yeah. Okay, so let's move on to the second part. Okay, so how to prevent the chronic knee pain. So there are a few tips that we can minimize how to prevent the knee. So whenever we are trying to, we encourage to walk down the hill, so that will reduce the stress on the knee, especially when we are running. That will put lots of stress on the knee. So instead of running, we will try to go down the hill by walking, not the running. And the surface of the area. So we always encourage to walk or jog on a paved surfaces rather than uneven surfaces. These uneven surfaces sometimes can move the knee in a wrong direction, and lots of force can happen when you twist or turn or pivot the knee joint. So as I said before, that can hurt the ligaments or meniscus as well. And get support for like custom-based orthotics. As I showed just before, any wrong alignments, not only at the knee, if anything, any wrong can happen in the foot, that can affect the knee as well. Okay. And we need to correct the gait problems. Just a second, please. So it is important to get the support for the foot, and it's important to assess any gait issues happening. So how you're walking, and is there any deviations in the walking, especially when you're doing up and down the hills, so when you're doing the stairs or normal, any imbalances in the muscles, hip, thigh, sometimes leg muscles too. And we need to replace the shoe. So we always tend to use the shoe for years and years because we feel my shoes are perfectly working. But when we look into, so once they're worn out in a specific areas, so you are trying to change the alignment of the foot, and that wrong alignment can affect the knee as well. So it is important to check the shoe every 6 months, once in every 6 months as well. Okay, so these are the simple tips that can prevent chronic knee pain. Okay. Okay. Just a second, please. Okay. So the factors that can make the knee pain worse. Okay, so injuries to the structures of the knee can cause bleeding and swelling that can create chronic problems over the time if not treated properly. Okay, so again, if any small discomfort, which is ongoing, and we don't know what could be the reason, and but the problems are happening like knee pain. Sometimes if you see the swelling, it is important to check right away. And it is very important to know where and why the pain is coming. Otherwise, it can turn into a chronic problem. Okay, and sprains, strains, overuse, and infections. These are the other common reasons. And sprains, strains can happen with the overuse or sudden sport activities, something like that. Okay, and if it is an infection, if any infections to the joint, that tends to degenerate or damage the structures really faster. So it is very important to get clear of that infections. Okay. And next one is the posture. So it's always we always like to stress to have a good posture, especially when you're doing any specific activity. Okay. Here, if you see this picture, this guy is trying to stretch his quadriceps, but what he is doing is, instead of he may feel that he's doing the exercise properly, but what he's doing is he's trying to bend his hip and bend his back and putting lots of load. He's doing in a wrong way. Instead of getting the desired result, he's affecting the other structures too. So it is very important what exercise to do, but more than that, it is important to know how we are doing properly. So this is where we need to get trained. Okay, and not doing the warm-ups and cool downs before the physical activity, that can put lots of stress to the tendons and the joints too. So that can give the problems. And as we discussed in tendinosis, this can happen a microscopic level changes in the tendons. If it is happening chronically again and again, that can give the chronic problems too. Okay, and the stretches here, as I showed here, we need to know what stretches to do, but more than that, it is important to know how properly to do the stretches. Otherwise, we are doing more harm rather than doing the good to the joint. Okay. So, four risk factors that can, just a second, please. 4 factors for developing the knee pain. Okay. So first thing is the weight of the body. Okay. So if we are overweight or if we are obese, we are adding lots of stress to the joint. For example, if we are carrying 2 bags of groceries really heavy, and if we do the stairs, by end of the top of the step, so we will feel lots of stress to whole body. Same way, we are putting lots of stress to the joints. So for every pound of more weight to the body, you are adding 4 pounds of stress to the joint. So it is very, very important to control the weight. Okay. And it is weight is a high risk for the knee as well. So because as I said in the beginning, so knee is the one of the joint, especially when you are walking, it takes, we attempt to put, we are putting whole weight of the body on the knee, especially when you are trying to when you are walking. Okay. Hello, can you hear the noise? So
Okay.
next one is age. As we grow up, there's a high chance to get into wear and tear of the joint. So unfortunately, it is not reversible. And so with age, there is a chance to increase knee problems. Okay. And previous injuries or trauma. So when we are young, if we have a more knee injuries, for example, injuries to the ligaments like ACL and injuries to the meniscus. So as we go, we tend to develop the knee problems, especially arthritic changes, earlier than the persons who don't have the knee injuries when they are young. Okay, so the previous injuries are the one of the common reasons to develop the chronic knee problems. Okay, and athletic activities like contact sports or physical activities with the poor technique. So it is important to know, again, we would like to stress this point. So whatever the activities you are doing, especially when you're doing the running or hiking, it's important to know the technique, how to do, rather than trying to complete the task itself. So if you're doing the job, I mean, if the knee joint is going in a wrong direction, especially when you're putting the weight on, you are putting the stress on different areas of the structure. So okay, for example, when you're trying to run, when you try to do a hike, so if instead of keeping the knee straight like this, if you're trying to twist the knee, you're putting lots of stress onto the inside the knee joint. So that can bring lots of stress. And if you're doing that repeatedly, definitely there will be a damage to the structures, especially to the ligaments or the meniscus, or sometimes a kneecap as well. Okay. So it's always important to know how to do as well as what we are doing. It's very, very important to know that technique. So that's one thing. Okay. So how to prevent the chronic knee pain? So doing the regular exercises with the simple stretches and participating in low impact activities like here the shorts, there's a simple biking, so that can help to reduce the stress on the knee joint, improve the flexibility. And losing the weight, it is very, very important. So as we discussed before, every 1 pound weight in you are losing, you are reducing 4 pounds stress on the knee joint. Okay, so it is very, very important to control the weight of the body. Okay. And what are the key muscles that we need to work on to support the knee? Okay, so there are key muscles, big muscles. Front of the thigh muscles we call quadriceps. Okay, and the back of the thigh muscles we call hamstrings. So we need to have a good flexibility and the strength as on both of these muscles. And another one, though it is not directly connected to the knee, our gluteal muscles is very, very important to make them really conditioned. And so what happens is the thigh bone is controlled by these gluteal muscles. So if you have a tight rotators, it is turning the thigh bone. For example, if this is my thigh bone, okay, if the muscles are really tight, it is turning my bone in wrong directions, and then I'm trying to move in a wrong directions like this. Okay, if the muscles are weak, and whenever I'm trying to bend, instead of going straight, it's going in in a wobbly directions, wrong directions, especially when you are doing the stairs, right? So we can check ourselves. So here I'm going to show on here, simple one. Okay, if we can see me, as I think I showed it before. So when I'm trying to get down the stairs, okay, if I am going, I mean, if my thighs is in good direction, it has to go straight like this. If in case if it is falling in, then you are putting lots of stress on the knee joint. So that control has to happen. Sometimes if we're doing the exercises, if you are doing like this, wobbly, and the balance is not that great, then there is a high chance to damage the knee structures, and you will develop a chronic knee pain. So problem is at the pain, but again, we need to see where the pain is coming from. Okay, so having a good hip muscles are very, very important to control the knee problem. Okay. Okay. Next, so how we have to resolve the problem. So now it is important to know where the pain is coming from. For example, okay, so I have a knee pain. Oh, I'll take rest and I'll apply ice pack. Oh, I can control the pain. Okay. And I did some activities. The pain has come back again. I use the ice pack and I have taken the rest, but it is coming back again and again. So we need to see where the pain is coming from. So what is the reason behind it? What is the root cause for it? That is very, very important to get know before we do the treatment. Otherwise, we will be doing the same treatment, but you're getting the same pain again and again. This is where you need to get the help. Okay, so we have to see not only the knee. Generally, we see the complete lower limb. Sometimes we need to see the back as well, where you need the treatment properly. Okay, otherwise the pain is not going anywhere. It will be like ongoing and coming down again and again. So that's one thing we need to make. We need to know what is the main reason why you're getting the knee pain, rather than looking at the knee only. Okay, and doing the right exercises is important as well. So pre and post, best thing to help to ease the knee pain is to do the right series of exercises. Again, yes, so right exercises is very, very important. So we need to know the reasons, and once we know the reasons, we need to design what exercise to do. As I said before, if hip muscles are weak, and if we are trying to do other exercises instead of concentrating on the hip muscles, without clearing the hip strengthening issues, the problem is going to stay where it is, because we didn't treat what is the main cause for the pain. So it is very, very important to know what is the right exercises, and it's very, very important to know how to do it properly. Okay. And the next one is avoid sitting in awkward positions. Again, as I stressed before, posture is the main important thing, where it reduces the stress on the joints. So for example, if we have arthritis, we will try to avoid sitting in too low for longer times, and sometimes crossing the knees or something like that. Okay. And there are some exercises where we need to stop doing, especially based on the conditions. So for example, as I said, osteoarthritis, it's better to avoid deep squats or too high steps or hiking activities like that. Okay. So doing appropriate strengthening resolve the muscle imbalance, as I said before. So muscle imbalance is one of the key reasons where you have not only the knee pain, so there are other multiple joints where it is affected with this muscle imbalance. So it's very, very important to have properly assessed and find where the problem coming from before we are designing the treatment plan. Okay. So this is an important way to resolve the knee pains. Okay. Next one. Again, so As a physiotherapist, we will do a real hands-on. We'll try to mobilize the joint, depends on the stiffness and depends on where we need, and we'll club with the virtual rehab. So because of the COVID situation, we were using the tele rehab as well before, and combination of these. So we are assessing you and to find what is the reason, and based on that, we have a wonderful rehab. We have built up a wonderful rehab programs designed for the knee, but again, it has to be different from person to person because the problems are different, reasons are different. So based on that, we will design exercises based on your problem. And we will do lots of hands-on way that helps to improve the joint condition. Okay. And that's what, so we have a proven rehab protocols based on problem where it is coming from. So it's important to know. And knee problems are the most common conditions where we are seeing in our clinics, especially clients with age above 40 years age. Okay, so that is one common area where we are seeing quite regularly. So that's what's exercise that makes the worse. So it's important to know what exercise to do and what to avoid and how to do. So listen to your body. So if whenever, for example, if you're doing an exercise and it's giving pain while doing or after doing, so it is important to see whether it is the right exercise for me or not. Okay. So it's better to avoid. Sometimes if you're trying to do running a lot and that's giving the knee pain, just to see how much load you're giving to the knee joint. Am I doing the right amount of running? Do I need to reduce before? And even that is giving the problem. So we need to find where the pain is coming from. And as I said before, if, for example, if you have arthritis, you should avoid deep squats, stairs, or high impact activities like heavy jumping like that. Okay. And what happens is if we keep doing those wrong exercises a lot, so there's a high chance to wear and tear on the cartilage within the joint and leads to a degenerative changes and inflammation, and it can lead to a really chronic problem, and that will disturb the day-to-day activities too, right? So there are simple, we'd like to demonstrate a few stretches that helps the knee. Okay, so it is important to know, and so let's try that. And these stretches, what we are going to show, that helps to reduce the stress on the joint, increase the flexibility. So the first stretch is going to be the quadriceps. I'm going to show here. Okay. So just a second. I'm going to stop the sharing first. Okay. And just a second. Are you guys able to see me? I'm going to show the first stretch called quadriceps stretch. So okay, just a second, please. Okay, so whenever we are trying to stand, it's important to maintain a good position. Okay, so I'm going to stretch the front of the thigh muscle. So just standing in front of the wall, keeping the back straight, just tilted, and try to bring the knee to the buttock level, to try to touch the knee to the butt area. So make sure it is important to do a right technique. So here, what I'm trying to do, I'm keeping the knee together and trying to bring it back gently. Okay. So here, the maybe I might, this may be, we may attempt to do wrongly. So what we attempt to do, we try to bend a lot, as I show, as the, this is a wrong posture. And sometimes we tend to do like this, okay? This can be a wrong posture as well, okay? So it is very, very important to feel the muscle is stretching here and try to bring it gently and maintain the good arches of the back, okay? That is one important thing where we need to go. And next one is the hamstring stretch, okay? Again, hamstring stretch is the back of the thigh. So here, I'm trying to stand up straight again, and I'm keeping the knee in front of a step, okay? And I'm keeping the back straight. Again, I'm not trying to slouch. Okay. Can you see me? Is okay. Okay, so I'll just try to adjust the camera. Okay. So here, what I'm trying to do, I'm keeping my back straight and I'm bending at the hip only. I'm not trying to slouch my back, okay? Video is not that properly arranged. I think this is better. Okay, so here I'm trying to stretch. I'm not trying to slouch. I'm keeping the back straight and I'm bending my hips only. So I should feel a good stretch here. Okay, that's to stretch the hamstring. That's one stretch that helps the knee. And next one is the calf stretch. So I'm trying to stretch my calves. The calf is the muscles where it is starting at the knee and connecting to the heel. Okay, so what I'm doing here, so I'm trying to stretch the calf on my left side. So if you see, so I'm keeping my foot straight and I'm trying to stretch this calf here. And I'm trying to bend the knee and just doing like this, okay? So I should feel a good stretch here. So generally we tend to turn the foot out like this and try to do like that. So that might not give the proper stretch to the calf, okay? So that's another stretch generally we go. And next one is, piriformis stretch. So I'm going to show, there are different ways to stretch too. So I'm going to show in the chair. I think we can try this one, okay? So sitting up like this, upright, I might cross the knee like this. And again, I'm maintaining my back straight and I'm bending at the hip as well, okay? So you should feel a stretch at the hip area. And you can bring the knee towards the opposite shoulder to make it more effective. All right. Is that okay? Right, so I'll share the screen again. Okay, so there's another muscle called psoas. So, okay, I think there's a video where Blair demonstrated all the exercises. So I'm going to run that video now. Okay. Share this. Okay.
Hey folks, Blair. From Nose Creek Sport Physiotherapy. So today's topic of the day is hip and knee stretches. I was just doing a virtual treatment with one of my loyal patients, and she was actually a neck patient, but she called me up for a virtual session, and she said, Blair, I've been sitting doing all these Zoom videos, and my hips and my lower back are starting to really bug me. So I said, well, the best thing to do is let's get going with some flexibility stretches for your hips and your knees and get you walking a little bit more if we can to decompress your back. So today we're going to go through the 5 stretches that you can do for your hips and your knees. So there's 3 for the knees and 2 for the hips, okay?
Oh, okay. It's coming. Belle, is it coming?
Yeah.
Hey folks, Blair from Nose Creek Sport Physiotherapy. So today's topic of the day is hip and knee stretches. I was just doing a virtual treatment with one of my loyal patients, and she was actually a neck patient, but she called me up for a virtual session, and she said, Blair, I've been sitting doing all these Zoom videos, and my hips and my lower back are starting to really bug me. So I said, well, the best thing to do is let's get going with some flexibility stretches for your hips and your knees and get you walking a little bit more if we can to decompress your back. So today we're going to go through the 5 stretches that you can do for your hips and your knees. So there's 3 for the knees and 2 for the hips, okay? We'll start in standing. So the first one's just a calf stretch. So you're going to go up against a wall, 1 foot forward, 1 back, okay? And then what you're going to do is lean forward so you get a strong stretch in your calf muscle. Can you see there? Okay, good. So there's the stretch there. Hold for 20 seconds. And again, repeat if you can 2 times if it's tight is my general rule. So that's the calf stretch. Okay, the next one is for your quadriceps. So again, your one hand on the wall, okay? You're going to grab your foot, knees together, and you get a little bit of a pelvic tilt, so kind of tuck your tail under. That'll shoot your knee forward. Then you want to pull the knee back, knees together, and then heel right to your butt. And you should feel a really strong stretch right in the front of your thigh and kind of the outside of your thigh, okay? So it's your quadricep stretch for that muscle right there in the front. And then the hip flexor, because when you're sitting, your hip flexor is in a shortened position, we want to lengthen that back out as well. So it's 1 foot forward, 1 back. We're going to bend both knees, so we kind of hunker down so the back heel comes off the floor. And then again, it's pelvic tilt. So as you tilt, you should feel a bit of a stretch here. You're engaging that stretch in the front of the hip. Then you lunge forwards 2 inches. Squeeze that cheek. So stick your thumb in that cheek to make sure you're getting a good strong stretch in the front. And then thumb up and just stretch back. So that'll kind of straighten up a little bit. You should feel a massive stretch right in the front of that hip in here, okay? And again, you want to hold for 20 to 30 seconds. So you can do those 3 in standing. The 2 you want to do on your back are just simply laying down on your back. You're going to grab your knee, grab with the same hand, so left knee, left hand, pull towards your opposite right shoulder. So across to the hip kind of stops. Take your opposite hand, grab just above your ankle, and then pull up. And you should feel a massive stretch in the back of your hip. Because we sit, when we sit, our knees tend to go apart when the hips relax. We get really tight in the back and the sides of our hip as well, okay? So that's your stretch for the back of the hip. And then the next one is for your hamstring. So a lot of my patients have had previous back injuries, so I don't advocate bending over to kind of stretch your hamstrings that way. Lay down, support your back, and simply straighten your leg out. So you get a strong stretch in the back of the knee, and then down into your hamstring. Okay, and you can even floss this out here by just going 1, 2, 3, 1, 2, 3. And do that about 10 times. Do that sort of 10 times, that puts that hamstring on stretch for a good 30 seconds. Okay, and just nice and slow like that. And you'll floss that sciatic nerve through that tight hamstring. And then you can just switch, and always make sure you do both legs. So just nice and slow, and then 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, okay? There you go. So there's 5 solid stretches that are gonna loosen up those hips and knees, and try to go for a little bit of a walk if you can, so you feel like you got a bit of a sweat going before you stretch, because you're gonna be more elastic and you're gonna stretch better if you're heated up, okay? There you go. So let's get going on those stretches between those Zoom meetings if you can. Try to incorporate a bit of walking before the stretching. Take care. Blair Shackley from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Take care. Bye-bye.
So those are the common exercises, and there are different ways we can present. So what's now? So you are here because you have the knee problem, right? So it is limiting your day-to-day activities and because it's giving the pain and limitation of the movement. And that is affecting your walking on day to day, and even you have the pain at rest, right? So now you have seen different conditions, why and what are the reasons for the knee pain, and so we need to see why and where is the pain coming from. So it's important to find out. So what happens next? So you need to make the decision and what you're going to do about your knee pain. So here in the Nose Creek, we all are trained to assess the knee, and not only we don't only look at the knee problem where the pain is. We always look into the main reasons where the pain is coming from. We will look body as a whole, and we will see not only the knee, we will see the foot, hip, and sometimes the back as needed. Depends on how the symptoms are and what are your main complaints, what are the where the weakness we are noticing, where the tightness we are noticing. So based on, we will do a comprehensive assessment, and based on that, we are designing a treatment plan for you based on what you want to achieve. So for example, if you want to go for running program, so where because of this pain you are stopped doing that one, and we need to see why you are having this problem. So it's only one specific area it is causing the problem, or is there multiple areas causing the problem? Based on that, we will design the exercises, and we have a wonderful treatment protocols which has been working for the knee patients. As I said before, the knee problems are the one of the common areas where we have been seeing from past. The Blair, he started this clinic 22 years back, right? So we are committed to restore and improve and enhance your health, mobility, function of our clients' conditions with excellent care and all our treatment rehab protocol programs. So as I said before, so here you will see a proven surgical treatment protocols of the knee that will provide the solutions for the knee problems. Okay. So here we got a feedback from for genuine patients, genuine Blaze patients. So I would like to run. It is a quick video. I'll just quickly run it. Okay.
Hi, my name's Emily, and I've been coming here at Nose Creek Physio to see Blair for quite a few years now. I'm a registered nurse on a busy hospital unit, and many years ago my knees had gotten so bad, kneecap pain, what they call patellar femoral syndrome, had gotten so bad that I couldn't run anymore. I had so much pain even getting down on the floor to play with my kids. And I was referred by my family doctor initially. I was a little bit nervous just because I associate physio with hospital surgical recovery. Hadn't really thought of physio more for chronic pain management, but I started coming to Blair, and my knees were bad enough. We did some good intensive therapy to get them on the mend, and then I learned a great many exercises really on how to take care of them and maintain the comfort level that he'd got me to. And they improved so much, I was able to start running again and actually just competed in my first triathlon, which was quite fun. And lately I've been coming to Blair just for a more acute issue when I fell and broke my arm. So I ended up back here again, working with getting my arm back to good strength so I can get back to work. It's been a lovely experience over, I think, almost a decade here. The staff do start to feel like your family as you come in and out. They know you by name and welcome you, and the scheduling has been very accommodating, especially when I work 12-hour shift works, being able to work it in and around my daily life. I have recommended people already to try it out, and I've heard some positive stuff, and I will continue in the future because I can't say enough about the whole team here at Nose Creek.
That's a great feedback. So, okay, so here's the knees are one of our specialties. So we have been providing the high quality treatment at Nose Creek Physio. So we have a proven track record, and we have been working consistently to our patients. And all our protocols are client focused services, and we design the exercises based on individuals' problems rather than like a as a whole one product, simple protocol. And so our previous clients serves as a their feedback is sorry, our previous clients' feedback is the results of what they have been got the benefit from our treatment plans. And if in case pain is limiting your day-to-day activities and preventing your ability to walk normally or even at rest comfortably at night, and this is a time to consider to see the experts. Okay, so let's get started. So there are many exercises and activities that can help to strengthen the muscles around the knee joint. And the most important is that it works for your lifestyle and your level of fitness, that the exercise does not create more pain. That's how we design the exercises. And we will give strengthening exercises, stretches, and balance exercises for the hip, knee, ankle to recover the knee issues. Okay, so generally it takes commonly what we see is it takes 6 to 12 weeks, depends on the severity and chronicity of the problem, and to get back to your day-to-day activities. So it's not only we aim not only to calm down the pain or improve the range, we aim to move you back to the activities what you want to achieve. So for example, if you want to go back to walking for certain distance, because of this pain you stop going out, we not only aim to calm down the pain to keep you comfortable, we aim to make you go back to that walking program. So that's generally that's long-term goal we aim for. Okay, here you are here, that's, yeah, we have the knee pain, right? So we can help you to eliminate that pain and you will be back to living to your high quality of lifestyle. So would you like that help? So please decide. And if you want those videos and exercise sheets of stretches what we have shown in the video, please leave a comment on the chat box. And because you are attended here, you are entitled to have a free discovery visit. So just give us a call to 403-295-8590, where we can spend 15 to 20 minutes to answer your questions, and we can decide whether physiotherapy is the right choice for you or not. And based on that, you can make the you can decide to have the physiotherapy, and we can show you how we are going to resolve your problem and how far we can take you. Okay, so I think that's the end of the session. Sorry I took a little extra time, so I'm passing it to Bell now. Thank you for your time and cooperation. Thank you very much. Bell, it's for you.
Okay.
Okay.
Thank you for that presentation, Chandu. And thank you for sticking till the end, guys. It's my turn to share my screen, and we will do the best part is the raffle. So all oops, there you go. Can you see the wheel?
Yeah.
Okay, so we'll be giving out 4 gift certificates for massage therapy. Okay, so the first winner is Stephen Gregory. Just have to write down your name. I'll draw one more. Oh, 3 more. Sharon Gregory. I wonder if they're related. 2 more. Judy, is Judy still here? And last one. And Fazia. Congratulations. Okay. And we expected so much information tonight, and we don't have time anymore to answer all these questions, but I can email you the answers. Is that okay? I'm not sure, but if you're still here, we can probably, because there's 1, 2, 3, 4, 5, like there's 7 more questions, Blair. But
Yeah, you can go ahead and answer them if you want.
okay, there are some. Hi, Chris.
Hi, Chris. Yeah.
There are some requests too for a recording, and I can send you that. Let me see if they're still here. Is Gordon still here? And I can open the mic for you guys.
The comment that Bonnie made about, telling when it's starting to rain in the summer, that rings so true. My mom, we used to be out in the garden when I was a kid, and she would say, "Oh, I think it's going to rain." And my brother and I would look at each other, and there wouldn't be a cloud in the sky, and we'd be like, "Ah, she's crazy." And then an hour later, it would rain, So we learned from experience that that I do believe in that barometric changes can be felt within a sensitive joint. So I totally agree with Bonnie.
Gordon's here. Margaret's still here.
Can I ask a question?
Sure, Flora.
In the first exercise where you pull your knee up or your foot up to the back, the very first one, when you pull your leg up to the back to stretch the thigh muscle, I cannot do that because it really hurts my veins or whatever. So is there like a, what's the word? Something else I can do instead of that? When I'll take my
Yes,
camera.
we can do that exercise in different ways. Again, we need to see what is the reasons why you are struggling. Okay, based on that, we can modify that exercise. So you can do that same stretch in side lying as well. Again, we have to see
Because I've
how
tried
far
many
you can bend, and
because
what is
many
the reason
people
why you are struggling with it.
I
Sorry?
even try using the band and everything, but it just hurt my veins. So, and then I get cramps.
Flora, you can bend over, put your foot up on a chair. You probably can't see my chair in my office. And then just slowly straighten up. Because it's probably hard to reach your leg. And then bend your opposite knee a little bit. And that'll give you a big stretch in the front of your thigh.
Okay.
Does that make sense?
Yeah.
So we call it the modified stretch.
Okay.
Maybe if I do it back here, you can see better. A lot of our kind of arthritic knees can't grab their foot. So instead we just get them to bend over, put your foot up on a chair.
I can't even do that one.
Straighten up till you get a big stretch, the knees together,
Okay.
like Shandy said, and then just bend your opposite knee.
Oh, okay. That would be better.
That's a really good modified stretch.
Will I do it on the bed instead?
Yep, like Shandy was saying, you could grab a belt or a towel and put it around your ankle and then just pull up that way. That would work too.
Okay.
Yeah.
Thanks.
Floria, I can
Any
send
other
you a
questions?
video. I can send you a video, the ones that Blair was demonstrating, the ones that
Okay,
he
thank
was
you.
lying down.
I do the one lying down and that helps a lot, but I find now I'm sitting more. So, and then I can't get outside to walk.
Mhm.
Oh, I can relate to everybody.
And I see Joanne just came in. Hi, Joanne. I can just send you a copy of the recording. So any more questions? Oh, Lily. Lily said, thank you. And Shirley too. You're welcome, Shirley. So I guess we can wrap it up, Blair, Chandu.
Thank you
Yeah.
very much. It's been great.
Yeah, thank you very much.
Yeah, you could just email any of the questions we didn't answer tonight, because we did run a little bit late, but that's okay. That was a great presentation.
Mhm.
And then the other thing too is, if any of you are interested in getting immediate attention from Bill to get a discovery visit, make sure you can just put something in a chat box right now, actually, if you want.
Yep.
And then she can look at the chat box tomorrow morning and then just call you back right away to get you in for a discovery visit with Chandu.
Mhm.
And that's just a free 15 to 20-minute session with Chandu to basically go through your knee history and just get to know you a little bit in regards to what your condition is and whether we can help you or not. And yeah, so take advantage of that if you can, and get in and see him sooner rather than later. Awesome. And thanks for coming out tonight. That was a great session. Good job,
Thank you.
Chandu.
Thank you.
I'll copy and paste all the questions, Shandu, so I can email. I can
Sure.
email it to all of them.
Sure. Yeah.
Awesome.
Thank you. It's been very good.
Good night.
Good night, guys.
Thank
Night.
you.
Night.
See you in the clinic soon. There's Lorna. Hey, Lorna. So I guess we had 4 staff members out then. Hey, Lorna.
Lorna's late.
That's okay.
Linda's here too. Thank you for coming, Linda. There's Linda.
I see you there.
Thank you. Great job.
Thank you
Good
for
night.
coming. Thank you
Yeah.
for coming.
Awesome.
Chandu, I'll send you the transcribe version of the chat. I usually get a copy and try to answer like all the
Sure.
questions, so I
Yeah,
can send
yeah.
it all.
Yeah.
There's a lot.
Yeah, and what I would do, Shandu, you can email those people back if Bill has their email or phone number.
I
And
do.
just call them. But if I was emailing them, hey, do you have their email, Bill?
Yes, I do. I do have the email and phone numbers.
Yeah. All you
Okay.
do is you say, hey, thanks for your question in the workshop. Sorry, I was running a little bit late. That's a great question. I would love to actually, either get you on the telephone or get you in the clinic so we can talk and do a deep dive on that question, because it's hard to kind of do it via email because I'd have to type like 2 pages or 3 pages. So why don't you just give Bill a buzz, give her a call in the office here, and I'll see you in a couple of days, or something like that, because that way you get them in there.